So in the review of this case, so we have a very young gentleman with diagnosis of a left-sided tumor, RAS, BRAF wild type. Therefore, in this case, obviously one of the molecular profiling that is missing would be MMR status. So I would probably check for that because patient is young, even though it doesn't seem like patient has any family history of colon cancer. So in this case, in the left-sided tumor, this is where the controversy we have is what do you do in a left-sided tumor with all RAS wild type? Do you use EGFR-based therapy or do you use VEGF-based therapy? So this is a question that I will have a discussion with the patient. We know that based on the at least the PEAK study, the FIRE3 study, and the COGB 8045 study that I just presented, there seems to be benefit of anti-EGFR drug over anti-VEGF drug in the left-sided tumor. However, the main issue of using EGFR drug in first-line setting will be the toxicity and the question of maintenance therapy. So therefore, I would have a discussion with the patient about the possible OS benefit of using anti-EGFR drug, but then some of the side effects that you must be facing for with rash and paronychia if you're on the EGFR drug for a long time. So I would have a long discussion with the patient, then decide whether to go with anti-EGFR drug or anti-VEGF drug.
Richard, thank you so much. This is a case which has we have a lot to discuss on this case. But Greg, first I'll come to you. These patients who have kind of all wild type, what are your thoughts about, should we look for other mutations in these patients or not? Microsatellite instability, definitely we would all agree that we should look for it. Anything else that we should look for in this patient?
So, I mean, obviously, Richard, and you kind of touched on it, it's a little concerning that the patient is 35 years old, a younger patient. So, certainly, you as is routine standard of care, you would want to make sure that you looked at the mismatch, repair proteins. And then, the other things, you potentially want to make sure there's a good family history. So even potentially a referral to genetic counseling just to make sure that there's not, some type of syndrome going on and whether, there could be additional testing that way. And then, in terms of, anything, past that point, there's generally smaller percentages of, potentially actionable mutations where, larger gene panel NGS, based testing, you may be able to pick up, these type of alterations. But if you're going to do these, type of tests, the patient really needs to be at an academic medical center where they'll potentially be able to, be equipped to kind of deal with some of these rare alterations.
I think, Greg, you brought up a great point. I'm going to ask you, some of the things that sometimes gets asked is, can you tell us the difference between germline and somatic mutation testing? Yeah. So how are they different? And if let's say nowadays, we do biopsy and we pick up something on these NGS testing, can you explain to us the difference between those and how do you work screen?
Yeah, so germline testing, is essentially testing, every cell in the patient's body for specific DNA alteration, whereas, somatic testing, generally refers to, cancer-specific testing. And, a lot of places are doing, so-called, tumor-only testing. So they're actually, they don't necessarily have a germline sample. So potentially with the somatic testing, you may also be picking up the germline alterations. And there's different, algorithms that are going into, some of these testings where they can sometimes try to make an inferral that, something, may be germline, versus, somatic or only in the cancer cells. But that's never, 100%. It can only, really, give you an idea. And in terms of the, somatic, testing, general guidelines to keep in mind are you generally want 20% tumor cell nuclei to ensure that you don't have false negatives. So at a heterozygous mutation frequency of 10% in 20% tumor nuclei, most of these tests have sensitivity at least to 5%. So you wouldn't really worry about missing things as long as you have that amount of tumor.
And it's very important. Mike, tell me this. I think seeing quite a few younger patients with colorectal cancer in my clinic. What do you counsel them? Do you send them for genetic testing? I think that's a very important point which you brought up, Greg, because sometimes these patients may show up and they do probably need a genetics referral.
Well, the first thing you brought up is we are seeing an increase in younger patients, younger than 50 now. And that's certainly been cause for concern because of the screening recommendations may need to be altered. In fact, there are recommendations now to lower the age of screening for colon cancer to 45. So it is an important consideration when we discuss with people not only the ramifications for themselves but for their family members. And I agree that in somebody with an unusual presentation, certainly if there is a family history or if they are particularly younger, we offer a visit with the genetic counselors to discuss other options. But I actually had a question for you, which is, at what point would you think it's important to be testing for probably the next most common mutation that would be targetable, which is really not a mutation, but an amplification of HER2?
Yeah, I mean, I kind of, we do a lot of larger panel testing, and so I'm not sure off the top of my head what the percentages are. I think you can probably correct me, but I believe it's usually somewhere around maybe 2%.
That's right.
On that level that have
2.5.
HER2 amplification, and I guess there's a FDA approved drug for that, but there's other mutations that I think we'll talk about. Maybe in some of the other cases that are at similar low levels, like that. The one advantage, I guess, in terms of doing HER2 testing, is it's cheaper with the immunohistochemistry to just run that test if you're concerned about that, as opposed to doing a large panel. But these large panels will pick up HER2 as well as other alterations.